Dr. Muttini and his team will now demonstrate the application of EDI on an ICU patient. They follow a simple standard procedure for insertion of the EDI catheter. Select EDI catheter size for the patient. You need to know the patient's height. A table provides more details. Make a NEX measurement from the bridge of the nose to the earlobe and then to the xiphoid process. This is the NEX measurement. Calculation of insertion distance for the EDI catheter depends on the catheter size and if nasal or oral insertion. Next, dip the EDI catheter in water for a few seconds and insert up to the calculated insertion distance. It is placed in the esophagus just like a normal feeding tube. If you intend to also use the EDI catheter as a gastric feeding tube, remember to follow your hospital routines for gastric tube placement. Verify the EDI catheter position by analyzing the ECG waveforms. Ideally, P and QRS waves are present in the top ECG curves. The P waves gradually decrease and disappear in the lower ECG curves, where QRS amplitude also decreases. If the bottom leads are highlighted, insert the EDI catheter further until the pink highlight appears in the center. If the top leads are highlighted, retract the EDI catheter slightly until the pink highlight appears in the center. The pink indication can only be used if there is a stable EDI signal. If the EDI signal is very low or absent, there will be no pink highlights. An absent or low EDI signal may be due to hyperventilation, sedation, muscle relaxants, or neural disorders. If the respiratory drive becomes inhibited, the EDI catheter can stay in place until the EDI signal is reestablished.
Our routine is to perform the NEX measurement first, and then we look carefully at the esophageal ECG waveform. Finally, we look at the EDI curve and perform an expiratory pause to note if the EDI signal curve coincides with the pressure curve deflection during airway occlusion. Now, we are ready to illustrate the value of the electrical activity of the diaphragm for this patient.